Red light therapy, RLT, is gaining massive popularity as a non-invasive health and beauty treatment, but many people still wonder, does it actually work? In simple terms, red light therapy involves exposing the skin to low levels of red or near-infrared light. Unlike ultraviolet, UV, light, which can damage the skin, red light is thought to penetrate deeply into the body to stimulate healing at the cellular level. The question is, how much of this is supported by science, and how much is hype? Let's start with what red light therapy is used for. It's commonly marketed for anti-aging, wound healing, pain reduction, muscle recovery, and acne treatment. Athletes use it to speed up recovery after intense workouts. Beauty clinics promote it for improving skin tone, reducing wrinkles, and minimizing scarring. Even mental wellness circles have started exploring RLT's potential for reducing symptoms of depression and improving sleep. The idea behind this therapy is based on photobiomodulation, a process where light energy is absorbed by the mitochondria in your cells, boosting energy production and potentially triggering healing processes. But does it actually work? Clinical studies show promising but varied results. For skin rejuvenation, several trials suggest that red light can improve skin texture, elasticity, and reduce fine lines. For joint pain and inflammation, particularly in conditions like arthritis, some users report real relief after multiple sessions. Muscle recovery also seems to benefit, especially when RLT is used immediately after training. However, the effectiveness depends heavily on factors like wavelength, duration of exposure, distance from the light, and consistency of use. That said, red light therapy isn't a magic solution. Results can be subtle and take time. Not everyone responds to the treatment the same way. Moreover, many studies are still small or preliminary. While the risks are generally low, especially since RLT doesn't involve UV rays, people with certain health conditions or those on photosensitive medications should proceed with caution and consult a healthcare professional. In conclusion, red light therapy appears to work for certain conditions, especially skin health, pain management, and muscle recovery, but it's not a cure-all. Its real power lies in consistent, correct application, often as a complementary treatment rather than a replacement for conventional care. More high-quality, long-term studies are needed to fully understand its potential. Still, if you're looking for a non-invasive, low-risk addition to your wellness routine, red light therapy might just be worth a try. Always consult a professional, do your research, and don't fall for exaggerated marketing claims.